Hello, and welcome to my training workshop. This workshop is designed to help new and existing staff members communicate better with patients and improve health literacy. This workshop will focus on two key areas of concern: communicate clearly with patients and address language and cultural differences with support of translation services available through telephone. Communication is key. Communication is one of the foundations of healthcare. Good communication is linked to improved patient satisfaction, adherence to medical recommendations, and health outcomes. Health disparities occur when there is miscommunication across certain patient populations. People with poor health literacy are more likely to misunderstand health information, face difficulty following medical advice, inappropriately or infrequently use healthcare services, have worse physical and mental health, experience higher hospitalizations, and have a shorter life expectancy. A person's ability to understand health issues and directions is related to the clarity of the information. Over 300 studies show that health information cannot be misunderstood by most of the people for whom it may be intended. Poor communication does a disservice to both the patient and the healthcare provider. Healthcare organizations and professionals have the responsibility to present health information in a way that patients, including those with limited literacy, can use and understand. Understanding health information for those that don't speak English can be extremely difficult. They struggle the most due to language and cultural barriers. Oftentimes, such barriers inhibit non-English or limited English-speaking persons from accessing the appropriate medical care. In addition to language and culture, social and familial factors play a role in the way people interact with the healthcare system. This can have a negative impact in the way we make medical decisions. Healthcare providers at times don't make the visit to the doctor's office easy. When explaining health information, providers use medical jargon and assume the patient understands the information, when in reality they don't. This is why communicating clearly is very important. There have been efforts on the national level to help improve health literacy. The National Institute of Health's Office of Communications and Public Liaison, or OCPL, developed an initiative, Clear Communication, that focuses on achieving two objectives. First, providing information in the form and with the content that is accessible to specific audiences based on cultural respect, and second, incorporating plain language approaches and new technologies. According to OCPL, 20 million Americans speak poor English and 10 million people don't speak any English. OCPL has created a number of resources to help trans NIH communicators and health communicators outside of NIH reach audiences where they are and overcome barriers to health literacy. OCPL has a website resource that provides synopsis of research. This initiative will serve as a resource to help to NIH staff, constituency public health and advocacy organizations, and to the public engaged in communicating about health in the community, schools, and other arenas. Here are some communication principles we can use as healthcare professionals to communicate effectively to our audiences. We can offer a clear understanding and break down the information, confirm the patient understands the information and encourage questions, and we can also use the teach-back method. To avoid communication gaps and confusion, the American Medical Association recommends that healthcare providers slow down when explaining health information, use living room language, convey most important concepts, involve family members, and use the teach-back method. The Department of Health and Human Services urges providers to use language access services such as Language Line when communicating with someone who speaks a language other than English. In this group exercise, staff will be broken up into pairs to complete a role-play exercise. One person will play the healthcare provider and the other the patient. Staff will switch roles and have the opportunity to play both the provider and patient. The purpose of this exercise is to help staff understand the importance of relaying clear and concise health information in plain language. Medical staff will see firsthand what it's like to interact with patients of various cultural and linguistic backgrounds. The exercise hopes to help staff understand how easily a patient can become confused and misunderstand health information. For this exercise, staff members will be assigned a role, either provider or patient, and each person will have the opportunity to play both roles. Each staff member will be given a scenario to enact based on his or her role, and each scenario will be different. An example of a scenario would be a provider will have to explain instructions on how to take blood pressure medication to a patient who speaks limited English. Staff members will be able to use written materials, visual aids, and nonverbal communication. Each pair will have 3 to 5 minutes during the scenario to converse. To evaluate the effectiveness of the group exercise, each pair will report back to the group to share experiences. Pairs will share successes and challenges during their conversation, and if they overcame or did not overcome those difficulties. They will state what materials they used, if any, and if they found them helpful. Also, pairs will discuss how they got the patient to engage, to ask questions, or if the teach-back method was used. This small group exercise expects healthcare professionals will become conscious of how they are communicating with their patients. Staff members that play the role of the patient will essentially be in the shoes of the patient and have a better understanding of why some people get confused or the information is not well understood. Healthcare professionals will also use this exercise as a tool to help them become better communicators of health information. Thank you.